Okay, today we're here in Carson City at Senator Debbie Smith's office in the Legislative Building, where this, our 77th, I got that one right, 77th session is ready to meet in just 5 days. I'm NAMI Nevada President Joe Tyler, and it's my wish that this, that other state legislators needing to know about mental health and listen and watch and see what Debbie Smith says about mental health and how it will be impacted by the funding which the legislature must vote on at the end of the session, if I'm correct, right?
Correct.
Okay, and then now during this brief interview, I hope to touch on what we must do to keep tragedies from happening, like the IHOP shootings in Carson, right here in this city, in Carson City, and have a common sense appeal for funding resources that will help improve the access to mental health care and to reduce stigma. Do you have thoughts on reducing stigma and resources and about shootings? Shootings are they're way too common.
Well, they are. And first, let me say thank you for talking with me today, because part of erasing stigma is talking about it and making it more common. And I think it has gotten better over the years. I was involved with NAMI 30 years ago, and I know a lot about the stigma. And so I do believe that it's an education process, and it's becoming much more common, and because of the press and social media, we know a lot more about mental illness now, and I think people have a little better understanding that it's quite common. If there's any good thing to come out of the tragedies we have, it is an awareness about mental health and whether we are doing enough about it.
Yeah, and that's what we got to do. So how can we stop the revolving door? Now, this is the toughest question. The revolving door where mental illnesses or people with mental illnesses are jailed and then put on the streets, and then jailed again, and then put on the streets, and it seems to me, now I do a support group on the Record Street homeless campus, and it seems to me that we've got to be able to stop this cycle some way, but I'm not sure how to do it.
Well, certainly resources are important, and as you know, we've cut a lot of money from the mental health budget in this state over the last several years. We've cut about $80 million from the state general fund in the past 5 years. We need to look at the resources in this state, and we need to make sure we're funding programs that address the needs of the very people you're talking about. Mental health court is another good and obvious way. It's demonstrated to work. It's demonstrated to be a good, sound way to keep people from that revolving door. They get a lot of attention, and they are often helped from having to cycle back through. I've been fortunate enough to sit through a couple of the graduations and a couple of the hearings at mental health court, and it's very inspiring.
Yes, it is.
And so we need to be listening to the people who know this type of work, and we need to be funding and putting those programs in place. We often fund the most expensive programs instead of the least expensive, because we fund the things that we have to do.
Yeah, and for the mental health court, now that's kind of an add-on thing in Washoe County. In Southern Nevada, they have a much smaller court, I guess. But
it really is about the resources to get programs like that up and running and sustain them.
And so my next question dovetails right on my next question. What will additional expansion funding for Medicaid, because we've got that piece coming. I think the governor signed that. So we got the Medicaid piece coming, and how do these dollars resonate? They always talk about this as being a good thing, that Medicaid dollars resonate within the economy to help the economy to recover as well as to help patients recover.
Well, the Medicaid expansion certainly brings a lot of resources into the state of Nevada. It puts a lot of access to care for people in Nevada, and certainly for mental health. So for people who didn't have access to mental health treatment, this expansion may give them some access. The governor's office, I think, predicts or projects about $17 million in savings of regular mental health costs, because those same citizens can be covered by Medicaid. We'll have to see how that plays out. What I'd like to see is that we reinvest some of that money into the other needs in the state. We know there's a lot of need in the state. I just came from a hearing where we talked about the suicide rate amongst veterans, as an example. Extremely high in Nevada, and they are being very aggressive in reacting. But again, it takes resources, and it takes all of our agencies working together to make sure that people don't fall through the cracks.
Is that like a wraparound kind of? Because there's a veterans court. Is that what you?
There's veterans court, and there's the veterans services officers, and then we have our regular health and human services agencies. So hopefully, if you can spread that program for suicide prevention through the various departments and agencies, it can be really effective.
Yeah, we know that veterans commit suicide at a very alarming rate.
It's a very alarming rate.
Yeah. But now this is another question. Why, Debbie, if we are to compete with for providers for these services, most especially psychiatrists, it seems to me that I just come away with the feeling that we could pay our psychiatrists more. I know for the fact that the state hospital, we're missing our best psychiatrists. We're having a tough time holding on to people.
Well, we are, but it's not just in that area. It's, as we've heard over the last several days in our budget hearings, it's pervasive throughout the state. We are having a hard time recruiting and retaining personnel in the state, and of course the professionals are even more so. We consistently have a hard time hiring doctors and nurses and social workers and IT professionals. Director Mike Wilden commented the other day, I think they have about a 10% vacancy rate. They have 500 open jobs in health and human services. Wow. That's a lot. But we have a couple of different issues. So with Medicaid, we don't have the best reimbursement rates, and so we are having a hard time keeping enough doctors in the pipeline for our Medicaid patients. That continues to be a problem in this state.
That's one that we should be able to do better at, because I've heard doctors say that now doctors can bill for not only the medication portion of the session that they do, but also for the talk and contact and service coordination session rolled into one, so they can bill for a little bit more, thus making their payments a little bit higher, and maybe we can reinvest that into their salaries.
Yeah, the problem is just the percentage of what we reimburse. We have cut overtime in our budget cuts, and some have been preserved. Some general practitioners, I think, get added back in this Medicaid expansion, but a lot of the specialties don't. So I think it's just an ongoing issue we have to keep talking about in the state.
Okay. And then one last question. How can the Affordable Health Care Act, the ACA, benefit the homeless population? And I'm leading you into this, so because I think NAMI can be a navigator, a consumer-based navigator to help people stay enrolled in health in the ACA.
Well, as you know, in the ACA, a large component of that is education. There's actually a significant amount of money that's set aside to help educate and use community organizations to make sure that our residents know they are eligible for coverage and they get enrolled. And so I think using those resources for community-based organizations is going to be really critical for us.
And I'm sure that would include Restart down on the homeless, and Salvation Army, and some of those consumer organizations that are already doing great support.
We have so many good organizations in the state. We have family resource centers that are always doing great work out there, and again, we have the veterans services offices, and so there's a lot of work to be done in all that coordination.
Can you think of anything to add to what?
No, the only thing I would add is that this is really an important time for our citizens in this state to be paying attention and involved in what's going on. Fortunately, we are in what looks like a recovery phase for the state on the budget, and we're not going into massive cuts. But we have to remember that we have cut hundreds of millions of dollars out of these budgets.
That's what you said at the start. $80 million we cut.
Just out of this, just
And
out
I-
of mental health.
Just out of mental health.
So we've
Yeah.
cut hundreds of millions out of other budgets. So I think it's really important just for our citizens who are watching to weigh in with their legislators and stay tuned in for the next 120 days.
Yes, okay.
All right.
Thank you.
Thank you, Joe.
Thank you, Dan.